Cervical cancer is the third most common cancer amongst females in Malaysia. So HPV, in long, it's called Human Papillomavirus. It's a type of virus and it's also considered a sexually transmitted infection. There are more than 200 different types of HPV. Some are categorized as high risk and some are categorized as low risk HPV. When you get a HPV infection, it could stay in your body for a long time. Most of the time, we are able to clear out that infection, but for some, it will remain dormant and changes in the cells of the cervix can happen over time. HPV is a sexually transmitted infection, so usually it's transmitted through sexual intercourse or even contact of genital areas. So both male and females are at risk of HPV infection. For those who have embarked on sexual relations or have had any contact with the genital area are at risk of acquiring HPV. So the HPV virus, once your body gets it, it will slowly remain in the cervix, the cells of the cervix, and over time, perhaps 10 years to 20 years, it will cause changes in the cervix. Sometimes it changes to a precancerous stage, and then further than that, it will turn into cancerous cells. HPV vaccine, if you have acquired the vaccine before you get HPV, it is up to 97% in terms of efficacy. So the earlier the better. Any girls that are of 13 years old and beyond will be able to get the vaccine, and that will be the earliest age where we will actually recommend HPV vaccination. If you are above 40, you are still qualified for the vaccine. Up to 40 years old is the current recommended guidelines. After the acquirement of HPV virus, the vaccine may not be as effective as it's deemed. Prevention of cervical cancer, we always would recommend doing your regular pap smear, and we can also test for HPV-DNAs together with the pap smear results.